Well, I left off last time about how they weren't able to put in my port during my lumpectomy. And so I had to head back to uh, the hospital a week later, a little less than a week later, to have that done. This was quite different than the first surgery, in and out in a really short amount of time. I did have to spend the night because I had to be there bright and early in the morning, but I was done before breakfast was over. They gave me coffee, they gave me some toast, and I headed on home. Now, with the first surgery, my doctor had prescribed me some pain pills, and I didn't need them at all. I didn't have any discomfort with the lumpectomy. I'd been told by a friend, when you take a shower, make sure you're stretching out your arm because it can kind of tighten up where they remove those lymph nodes, where they remove that lump. I did that. I didn't feel any strain, any reduction in motion. And so I went into the second surgery, and I mentioned last time, I'm a newbie to hospitals and surgeries and all that. And so after that, went home thinking nothing of it. Well, that evening, oh my gosh, the pain just became overwhelming. Was sitting on the couch, tears just streaming down my face. My stepdaughter went and got the oxy that my previous doctor had prescribed for the lumpectomy. And this is, I guess, a fairly well-known fact, but if you are naturally a redhead or have red hair, kind of in your genetics, for me, I've been a strawberry blonde when I had hair. Um, your ability to handle like numbing agents, pain medicine, is really high. And so you oftentimes might need a couple shots of Novocaine, a couple shots of lidocaine, more pain medicine than somebody that doesn't have that red hair. So, for example, my husband was on some pain medicine after he had a heart attack and surgery. And he said he could take a pill and he could feel it starting at his toes and working up. For me, I take a pill and I feel nothing. So I ended up taking two pills that night just because I needed the pain to stop. I needed to go to sleep. Fortunately, it was very short lived. And by the next day, the pain was completely gone. My husband thinks that the vein area was probably bruised from them trying so hard to get that first port in. I don't know. I don't care. It hurt. So I went back to see that second surgeon a few days later so he could do a post-op checkup. And I mentioned earlier that we were going to do a lot of shoulda, coulda, wouldas, and this is a red flag. I told the doctor's nurse how much pain I was in. I couldn't believe they didn't give me any pain medicine to go home with, and he laughed. He literally laughed at me. I mean, who the hell does that? Like, I wouldn't have brought it up if it wasn't true. It was past the point. I wasn't fishing for narcs. So that should have been yet another red flag that this was probably not the hospital, and the clinic for me was not going to be a good fit. But we got through it, and now I can finally start on chemo. I finally got to meet my oncologist. I finally got to hear what they were going to do, the drugs they were going to give me, but I had no expectation of what chemo was. I'd only seen it from like movies, like Stepmom, um, or a couple others that have been out there where they're just violently ill and then they end up dying. And I didn't want to go down that path. So neither my husband nor I knew what to expect. So we went into chemo the first day really with no understanding. What I can tell you is chemo's boring, or it should be boring. Hopefully, you won't have any adverse reactions to the drugs they're giving you. So you're just sitting there. You're sitting in a chair that hopefully reclines, is hopefully comfortable. They may hopefully offer you a warm blanket. Um, I wasn't offered any of that. Uh, you're going to sit there during pre-meds. You're going to sit there while they give you the medicine. You're going to sit there while they flush out that medicine. You're going to sit there while they give you the next medicine, rinse and repeat. Finally, you're going to end with a flush, and then you're going to get sent home. And during this whole time, you're just sitting there. So if you have a friend or a family member, or you're looking to go into chemo, find something to entertain yourself with. Good set of headphones that can be noise canceling, some great podcasts, books on tape, a subscription to Audible or Pandora so you can listen to music while you're sitting there. If you're into knitting, make sure you bring your knitting bag with. If you like reading, if you like doing puzzles, make sure that you've got all of that with you because you're sitting there for hours. Um, the first time my husband sat with me, after that, we realized there was nothing for him to do. And since we were almost 2 hours from home, sent him off shopping so he could do that while I was getting treatment. After my first treatment, we headed home. I was feeling just fine. They had told you if you have any problems, any nausea, contact us immediately because they have medicine to treat that. So I went home and didn't really have any problems. Had a little bit of a nervous tummy, but that I think was the stress of the not knowing what chemo was going to be like because I never had it again. And that was day one of chemo. However, after chemo, at least when I did it 8 years ago, they gave me a follow up drug to be taken the next day. It was stuck to me. It was called Neulasta, and it's to boost your white blood count because chemo takes out all the bad, but also all the good. And so your white blood count can go really low, and you can be really prone to infection and, getting a cold, whatnot. And so I had to take the shot. Um, a few things we're going to talk about, and we're going to talk about it more when I skip to talking about financials in an episode or two. But I was being charged a hospital rate for that drug. And I looked it up under my insurance plan, and my pharmacy copay was literally over $1,500 less than what they were charging me. When I brought it to the attention of my oncologist, he told me, oh, well, they're used to dealing with people on Medicare and not people with good health insurance that have a pharmaceutical portion. Well, thanks. Thanks for somebody talking to me at, that's another red flag, at a different clinic that I went to later. I was given a, like, kind of a patient advocate. Sometimes they're called social workers. Um, somebody there to help kind of walk you through, make sure you can afford what's happening, make sure you understand what's happening, give you information on maybe classes that are being offered to folks that are going through the same thing as you, kind of support groups, talk to you, all these things. I was offered none of that at this first place. So I learned by trial by fire, essentially. And so when I found out that I could have my oncologist just prescribe it, which is what he suggested he does, picked it up at my local pharmacy, slapped it on me. 24 hours later, it goes off. The next thing they never told me about, but fortunately, a good friend of mine did, who she had gone through cancer, was that shot was going to make you feel like you had the flu. every joint was going to hurt, your bones were going to hurt, your back was going to hurt because it is accelerating how quickly you are building white blood cells. And those are done in like your femur, your hips, your spine. And she suggested, she's like, make sure you have on hand some Benadryl and you might want something like Aleve. And so nobody had told me that at the doctor's office until, I brought it up and they're like, oh yeah, that would work. Well, thanks a lot for telling me that before I started these shots. Thank you, Tanya, for telling me before I started those shots. So in the last 4 minutes that I have with this video, I'm going to just run through a whole slew of side effects you could potentially have. So obviously losing your hair. I knew I was going to lose my hair. They told me I'd lose my hair. Rather than wake up with big clumps of hair on my pillow or pulling big clumps of hair out when I'm taking a shower, I became proactive and had a party where my friends and coworkers and employees got a chance to style my hair, cut my hair, and then at the end we just shaved it. And I'm glad I did because I think that would have just been too depressing. And I have never been attached to my hair. So other side effects can be, the nausea, can be mouth sores, can be neuropathy in your feet, can be brittle nails. A lot of folks are like, oh, well, a positive is you're going to lose weight. Yeah, no, I did not because I was on steroids. And what the steroids do, it makes you really hungry. And so I would be lying in bed in the middle of the night thinking, God, macaroni salad would be really delicious right now. Also, steroids keep you awake all night. Yay. And for me, the following day, it makes me flush really, really bad. I mean, I'm just like beet red. These portions of my cheek turn purple. It's really uncomfortable. And when I brought that side effect up to the nurses at my first clinic, I was told, go put your face in a river. So again, red flag. Not sure why I stayed there for all 4 treatments, but kind of felt like I was committed and had to see it through. So other side effects that you can have is you could potentially have a side effect to the drug. And I'll talk about that in a later episode. You can end up with, I think I already mentioned, neuropathy. I do have a link to Linktree that talks about a bunch of things that you can get to kind of offset, the loss of hair on your head, neuropathy in your hands and feet, that kind of nausea, that constipation. But one thing that I had never been told would happen, so women out there that are premenopausal, is chemo can and will likely throw you into menopause. And it's not the menopause that your mom or maybe aunt or older sister went through where they're like, oh, I had premenopause and then menopause and I took a couple hormones and I felt great. No, because I have triple negative breast cancer, I cannot take any hormones. So there was no hormone replacing therapy. And I went from not being menopausal to bam, I had menopause. And a friend of mine researched it because she was doing the same thing. And you will experience it 10 times more severely than if you went through it in a natural sense. So as soon as it hit, I was up all night with night sweats, flushing, couldn't get back to sleep, horrible insomnia. My nights of having 8 hours of solid sleep, haven't experienced it since. And it was miserable. So nobody talks about it, but if you're not already in menopause, expect it and talk to your doctor. I think today there are some non-hormonal treatments for menopause. So thanks for listening. Again, I'll have those links and I'll try to do way better on getting these out there.